Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Welcome back to this In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about what you need to know as you welcome back patients and reopen your practice. We want to help you minimize the exposure to COVID-19 and establish best practices in your office going forward. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you.
Thank you, Allison. It's been another busy week as offices start to reopen. It looks like the entire United States that orthodontic practices are resuming normal or regular patient care versus just only seeing emergency and urgent patients.
Yeah, exactly. Well, today I know we wanted to talk about training, specifically how practices can ensure they are taking basic standard precautions at this time. We've talked a lot about the specifics of sterilization and infection prevention, but as you've said, it's time to go back to basics. So, as you mentioned, most states have reopened now, and most orthodontic practices have resumed or will resume seeing regular patients soon. What are you hearing from team members that are talking to you?
Well, the team members are a little anxious about going back to work. They wonder, how safe am I going to be as an orthodontic assistant, as the orthodontist? How safe is it going to be in our practice for our patients as we resume? Because there are a lot of unknowns with this aerosol disease transmission, with this emerging virus. We've heard about the stories, and the infection numbers keep rising and rising, and the number of deaths. But I am seeing going down the curve now. It looks just a very gradual decrease that we're seeing that lessen. And as we talked about last week when I mentioned Dr. Don Spiller's office and that Eden had called me and she said, oh yeah, I feel so good about resuming seeing patients and really confident with what we're doing in the office. I think that confidence comes when the team has done training. They've set aside the time to review standard precautions and then to review the aerosol disease precautions and be confident that both the products they're using, the technique they're using does provide the safety and the protection for both the team and for the patients as they come in. We've been so focused both in the dental profession and ortho profession on the lack of N95 respirator mask and getting that PPE, and then of the disposable gowns, that very often that scrambling, if you will, to order supplies and being shocked at the astronomical cost of them has set aside that training, that confidence in basic disease transmission, how you break that chain of transmission and provide safety, both for employees under the OSHA guidelines and for patients under the CDC basic and standard precautions. Yeah.
So where should that training start? What should be the focus?
Well, there has been a number of webinars, and even with our In the Sterilization Room with Jackie, we focused on the different techniques. The AAO on their staff club has some great webinars. I know there are two of my webinars on there that is on OSHA for employee safety and on infection prevention. And so they can go and join the AAO staff club and have that available to them. Another good resource is OSAP, OSAP.org. And OSAP puts together a workbook, a training book, really a textbook on infection prevention and OSHA safety. And then another great resource is Trapezio. Dr. Doug Depew put together Trapezio training, and for orthodontic assistants, basically on clinical procedures, and then they also have other infection control and OSHA safety. So there are a number of resources for training. I've been doing a lot of Zoom meetings.
I would imagine.
And I really enjoy doing the Zoom training for offices. We schedule about 2 hours. I go through like a 90-minute and I customize it as much as possible as I can for the office. If I've never been into the office, maybe have them send me some photos and ask questions. And then as I'm going through it with a Zoom meeting, just as you and I are talking now, I'm able to talk with the team. And so when we get to disinfectants, and I said, and I talk about, well, you need to verify that your disinfectant that you're using is effective against the coronavirus. And you can go to the EPA healthcare disinfectant in list and verify that. And then I'll ask them, well, which brand do you use? And because we're on a Zoom meeting, they can either hold up their container or they can tell me which one it is. And I'll go, okay, let's look on the in list, and I'll look it up for them and say, yes, it's proof. Now, what is the wet contact time on your disinfectant? And often they'll look at each other. No. And then I'll get a guess. Somebody will venture 5 minutes, 3, and I'll go, well, read the label. Turn the label around to the directions for use. Remember, we've talked about those IFUs in the past, and see what is the wet contact time to kill all pathogens. Same thing when we get to instrument cleaning and sterilization. I'll ask them, now, which ultrasonic cleaner are you using in your ultrasonic? And the doctor will look at the team, and the team will go, and I'll go, okay, you need to know which brand you're using, and then how many ounces or how many tablets for the tank size of ultrasonic. If you have a 1 gallon tank or a 2.5 gallon tank, the measurement is very different. And I've seen many offices that they've changed brands over a period of time, and maybe the concentration, the amount they were supposed to add to a gallon was different for that new product, but they kept using the same measurement as for the previous product. So now's a great time to review standard precautions. And so when I finish doing that 90-minute training, then they can ask me questions, and sometimes they'll even pick up their laptop and they'll walk around the office and they'll show me the sterilization room, or what can we do here? We're going to use this for our aerosol room where we're doing aerosol procedures. So we can customize that. And then we'll take a training log sheet, just like this, and they'll fill it out. And this becomes their documentation of training. OSHA requires that we do annual training updates. It doesn't have to be one great long training update, but it can be done in segments focused on a different topic. So for this training sheet that I did, I'll be working with Cater Orthodontics in New Jersey this afternoon. They're going to start seeing patients next week. And so we'll be going over basic CDC and OSHA guidance for resuming patient care and the standard precautions with it. So training is important for the team to be confident, both in standard precautions, and then also be confident with the new precautions that we're taking for aerosol disease transmission, such as those N95 masks. And how often do we change our gowns, and how do we take them off? So all of those details, it's nice to be able to work them out, everybody together. Everybody hears the same information at one time. And now you don't have team members coming back going, well, nobody told me about that. And they have the confidence. That confidence is communicated to patients as patients start coming back into the office too. I've even had questions from orthodontic patients that somehow or another found my name and phone number that have called me about, how safe am I going to be? Why did my orthodontist ask this question, say, prior to coming back into the office? So it's important for the team to be confident, knowledgeable, and be able to communicate that to patients and know that they have the right training as questions arise, or they happen to have a new issue come up. Then if they've got the information, they can think it through. What's the professional approach to this topic?
Okay. Well, let's talk a little bit about a part of that training should involve the patient triage process, which you just mentioned that you had a patient that called you. What should that process look like, and what training does the team need?
Yeah, well, we've identified the symptoms that are associated with a COVID-19 infection. And that first thing that as the patient comes to the office is we're taking their temperature, either the forehead temperature or the disposable thermometer temperature, and that 100.4 is the threshold. If the patient has a temperature above 100.4 Fahrenheit, then we're going to reappoint them in 2 weeks and for their symptoms to resolve. But for instance, I had one ortho office call me and they said, well, we had mom come in and she filled out on the wellness screening form that her daughter has a cough. And so we didn't see her. And she was very upset. She goes, well, she has allergies and hay fever. She'll have a cough for the next several months with this. And once I talked with the team, I said, you know, with that type of situation, there is a logical explanation for that cough. I would look for 2 or 3 symptoms, not just one symptom that the patient just has a headache. That could be stress related or cough that could be allergy related. But if they have 2 and maybe they don't even have the fever, yeah, then that's cause for concern. So the team that's doing that patient triage, both in the telephone call before the patient's appointment, and then as the patient arrives in the office, they need to have a comprehensive understanding of the disease transmission and the signs and symptoms, and at what point are we going to delay treatment for this patient. And again, similar for the team members when they come to work in the morning and we're doing the wellness screening for them. If somebody just arrives with a headache, it's probably safe to go ahead and see them. But if they have a headache combined with a loss of taste and smell, yeah, then that's a red flag. Then it's possible that we may want to delay them working that day, send them home, and see what the next day brings. And with the hot summertime coming on, they're going to have patients that might arrive with a temperature just from being in a hot car.
Right.
So it may be that if that temperature for the patient or team member is elevated, if they can either send the patient back to their air conditioning car, have them sit in the entranceway or in a hallway and let them cool down, and then take a temperature 20 minutes later, it could be well within the safe range. So having that training, discussing the possibilities before is going to ensure a smooth reopening of the orthodontic practice.
Right. Is there, the patient triage process, that's something new in terms of training. It's not something that the staff and orthodontists were looking at before. Are there any other new kind of aspects to this whole best practices, precautions that team members should be looking at as part of their training and maybe really focusing in on?
Well, the aerosol again is the challenge on it. We've put those sneeze screens at the front desk,
right,
even for the team members. And then in the treatment area, the aerosol generating procedures for the orthodontic patients are scheduled very often in a separate room now. If they had a treatment coordinator room that they could repurpose as an aerosol generating procedure where they are able to even close a door to confine those aerosols, it may be that the office has put up screens in between each patient and then included air purification filters, or even have one of those extraoral suctions. Or the intraoral suctions, and not just the saliva ejector, not just the slow speed, but the intraoral suctions that's attached to the high volume evacuation. That's going to give a 90% reduction of the aerosols. So we're not just relying on PPE. PPE has been a focus, I think, because of the shortage. But again, paying attention to standard precautions and using that equipment to reduce the aerosols is providing that benefit protection for both the team members and for the patients.
Yeah, and I think that knowing all that and having that training is really going to alleviate some of that anxiety going back to work. So
yes.
Well, I think this is great information for our viewers. So thank you again, Jackie, for being with us. And we will be back next week for the next episode of In the Sterilization Room with Jackie. If you would like to view previous episodes or get the latest orthodontic industry news, visit our website, orthodonticproductsonline.com. We are here to help you as you get back to work. Until next time, take care and stay safe.